It is Tuesday, May 19th. It is yet another day here in Hawaii. So glad that you could join us here for the COVID care conversation brought to you by the Hawaii Executive Collaborative as well as Hawaii Pacific Health. Good morning, I'm Ryan Kalesuji.
And good morning, I'm Yenji Denise. Thank you so much for being with us here on Tuesday. We are so lucky to have Scott Murakami, the Director of the Department of Labor and Industrial Relations, joining us. Tuesdays are always a busy day for us here on this show because so many of you have unemployment questions. We want to get to as many as possible. We do go back and look at the previous week and try to boil down those questions. So please, we know that a lot of you are writing in. Keep continuing to write in your questions, and please know that we have gone through all the previous questions. We try to distill those for Director Murakami so that we can have a very productive conversation.
That's right, 436 comments that came in last week, Tuesday, over 700 the week before. So a lot to go through, obviously, and we tried our best, again, to sort of condense those things. Before we get to the Director, good news that was announced yesterday, no new cases in Hawaii with COVID-19 cases in Hawaii. So again, a great sign as we hear more from the governor. He revealed that color-coded system that the state will begin implementing in the different phases of the reopening of Hawaii. So, so far so good, and we continue to see those numbers stay low. But right now, we want to bring in Director Scott Murakami to the conversation to talk a little bit more, of course, about the updates to the department and all the efforts that's being made there. Good morning, Scott. If you can maybe start off by sharing us an update with some of the numbers and where you guys are at right now with that backlog of claims.
Sure. So as of May 18th, we were able to process 169,874 claims. That's 71% of all of the claims that we've received. Of that, we paid out 126,798 claims. We have denied 43,076 claims, and we still have 68,177 claims that are in process that we're working on.
And last time you were here, you were saying that you were getting 1,000 to 2,000 claims a day, I believe. What's the rate like right now?
We still are receiving about that same level. I think a lot of those are people who are providing replicated claims, but it's about that same amount.
Okay. Sorry, go ahead, Ryan.
One of the things that we want to maybe do is, before we get into some of the new questions, is follow up on some of the questions that were asked last week. I know that you said you have to go back and get some more information. One of the questions that came in last week was regarding qualifications and tax information. So our pool applicants they're asked to provide the 2019 tax information, but are they allowed to provide 2018 tax information instead if they have not yet already filed for 2019, being that was extended?
Unfortunately, by the federal requirement requires us to use the 2019 tax year as the basis for determining someone's eligibility for the pool program, as well as the benefit calculation. So if you have not filed your 2019 taxes, you can submit other documents that establish what your net income was for 2019. Those can include, on the revenue side, 1099s, other types of receipts that you may have received or that you may have issued for payments that you received, as well as the expenditures that you have. So things like bank receipts, billing notices, things of that nature. But anything that helps us establish the 2019 net income for that individual.
We have a question here. Where did it go? So there's so many people writing in about backdating. That some people say that I'm trying to file for backdate claim, can't get through. I've emailed multiple times. If the date is not correct, if you've been separated from your employer earlier than what the system has determined, how do you resolve that?
So we do have a backdate email, and I appreciate, Marshall, that you sent your email there. I can tell you that we have the Kauai office of the Kauai UI office, as well as 6 people working in the convention center to address all of the backdate issues. So really what happened is I realized that the system did go down on everybody. This was back in the mid of March. And so as a result, that did create this problem where people had to file their claims later. And then the separation date they had. But I can tell you that we are getting through them. We will get through all of them, and I just appreciate everyone's patience in that.
So if they already did email that backdating email, just continue to wait for
Right.
a response from that.
And we are working through it, but again, we just have a lot of claims, and the 68,000 are in addition to things that such as the backdating issues that we have, because some of the backdating issues, people may have received payment already on some of their more recent claims, but we're trying to make them whole for the ones that they had missed earlier.
Okay.
How is the response time going? I mean, when we've talked to you for many weeks now, and we've seen the progression as you stand up more volunteers. How quickly are calls being answered and emails being returned?
So that still is not as quickly as I'd like it. I'd like to see it, quite frankly. I think you know, I guess the best way to put it is what's slowing us down now is that the types of questions are much more complicated. So a lot of the simpler things about certifications and whatnot, we've been able to work through. Now we're getting to much more complicated questions that people are bringing up. Questions about that their separation from work, things of that nature that are a little more challenging for our call center people. So we're taking a little more time to try to answer those questions instead of having to call them back, and that's why we're seeing some delays in it. Like I guess one of the things that I guess not to say happy about, but one of the signs of progress is that the questions are becoming much more difficult. They're not the rudimentary types of things that we saw in the past. So we do see part of the problems being that the response for each individual claim takes a little bit longer now.
I want to go back to that certification question that you kind of brought up, because there was a question that was asked last week and we needed to get some clarification on. Some people saying that if they had issues with, we know that there was like a 3-week timetable, but they were unable to file and provide the qualification materials needed, would that necessarily make them disqualified if they fell out of that 3-week window?
So what happened was we actually removed the inactivation for the 3-week window for certifications. Because you're right, if a claimant doesn't follow certification for 3 weeks, unfortunately, what happens is their account becomes inactivated under normal circumstances. But on April 25th, what we did was we implemented a solution within our application that removed the inactivation code. So the claim stayed active regardless of whether or not somebody filed was able to get in within that 3-week period. Unfortunately, if you were affected before 4/25, those are the claims that the certifications that we've got to go back and manually address.
John Ark has a question. Will unemployment claimants need to post or complete resumes at some point on the Hawaii Net Hire website to continue to qualify for the benefits? I know the searching for 3 jobs a week requirement was waived, but I'm curious about John's question.
John, I think we did waive that by executive order, but I do think that it would be beneficial for people to put their resumes up on HireNet Hawaii, because we do have people looking for jobs. One of the things that I can share with you is that we also, in addition, I know a lot of the conversation has been about unemployment insurance, but we also have a program called Rudder, Reducing Unemployment Disruption and Driving Economic Regeneration. And what it does is it provides $1,000 to businesses who are hiring people since March 1st. It pays $500 upon hiring, and then another $500 after 6 months. And what the fund was meant to do was offset any kind of training costs that the company has. And a lot of those companies are still hiring. My last check was we had issued about just about $100,000 in the first 6-month payment portion of it. So the best way to get recognized by those companies is on HireNet. Now, whether or not that's going to be a requirement or not, I'll look into that for you and determine whether or not it will be a requirement. I think ultimately we're going to have to at some point have people apply for it or get back on HireNet. I just don't know when that's going to be, John.
All right. One of the questions that we had come in that was sent to us last week was regarding, of course, the pool claims and the 1099 workers. Now, one of the questions that came in was from John, and he asked that how do people who are 1099 workers that have multiple jobs and for different employers still as an independent contractor file for unemployment benefits? do they have to fill a different claim for each job or gig, or do they combine all the sources of income together? So we know a lot of musicians maybe have multiple employers or whatever it may be.
Right.
How do they file?
So, John, I'm going to make the assumption that all of these jobs that you have are gig jobs, that there are independent contractor, bona fide independent contractor types of jobs, and none of them are wages. So, assuming that all of those claims would be compiled, and all of those gigs, I guess you could call it, would be combined together and filed as one claim. So, the best way to look at it isn't from your revenue sources. It really is based on you as an individual, because the determination for benefits is calculated on your individual net income. So if you have multiple sources of income coming in, it consolidates to yourself, and then the expenses are run off of that. So that's the best way to look at it. Yeah, if you then get called back for a particular gig, let's say, it really the real determining factor is how much you're actually earning from that gig on a weekly basis. If what you earn on that week exceeds your weekly benefit, then at that point your benefit would stop.
Okay, got it. And so if they were to, for those still kind of in that same line of the 1099 workers, what if they get one? So if they get one of those jobs back, but still they are still having obviously a lack of income because of other jobs that haven't been submitted, you're just saying that they're going to have to sort of assess and go one at a time as those jobs come back online?
Right, because the real issue is you can maintain your benefit as long as the weekly benefit exceeds the amount that you earn during that week. That's the best way to look at it. And once you've exceeded more than that, then you would, of course, have to you would lose your benefits at that point.
Okay. Another question is kind of a simple one, just asking, how do people file for Backpay? Here we go, from Lisa. How do we file for Backpay? I know that there's multiple, obviously, factors and obviously different ways to do that, but what is the best way to do that?
So, Lisa, we do have a Backpay website. My desk is absolutely a mess, but we do have a Backpay website, so you can just email us and let us know. Oh, here we go. Let's see. It's DLIR.ui.backdate@hawaii.gov, and we do again have people in the convention center, 6 people in the convention center, as well as the staff on Kauai going through those email addresses.
Tracy Adams, and excuse me if you guys have covered this. Sorry, I had some connectivity issues here for a second. She says she still hasn't been able to log into the website to certify, and attempts to confirm what my login information by phone for 3 weeks now have been unsuccessful. How do I reach a human to get help with my login ID confirmed and certified to get paid? Gloria, just above there, says, when will you fix the high volume issues, the please try again issues? I wonder, for both of these people writing in, and there are many people who say that they haven't been able to connect. Are there any plans to actually open a physical space where someone could go down and stand in line and talk to a person? I think a lot of people would feel a lot more reassured if they weren't having to go through technology, but they could actually speak face to face.
So I can tell you that for our systems now, we are able to receive a significant amount of certifications online. So, for example, this past Sunday, we took in 68,000 certifications, and we didn't see any system degradation. So if you do get the high volume message, please don't quit on it. Keep clicking on it a couple of times, because it may take 1 or 2 tries. If you click on it once and it doesn't work, you're probably doing it during the high volume times. I can tell you, if you do it later in the evenings, it seems to work. The traffic is less, I can tell you. But we haven't seen any real system degradation from it. But there is just a lot of traffic. So if you try clicking on it a couple of times or 3 times, most people by the 3rd time have been able to get in. I can tell you, Tracy, you're not alone. By our data, it's suggesting that there are about 9,000 people who have actually filed claims that are clean, that there's nothing wrong with them, but they haven't filed a weekly certification. And so what we're doing is, we have 20 people now in the convention center that are actually calling these individuals and walking them through the process of certifying. So, Tracy, if you're one of the people whose claim has been processed cleanly and you haven't had a chance to certify, I can assure you that we are trying to call those individuals up and work with them on how to actually file the certification, because it's pretty clear that that they have done everything up to this point accurately. It's just a matter of working with them to make sure they know how that they have to certify and how to actually do that.
So in terms of actually being able to come in person, do you anticipate the office opening at any point, or are you just tabling that for now?
So we actually are in planning we're going through planning stages with all of our divisions within the department on how best to address this. And what I can share with both of you as well as your viewers are that, our first concern is clearly for public safety and the safety of our claimants. So as long as we can assure adequate social distancing, as long as we're in compliance with the necessary federal state requirements, that's our first concern. And of course, the other concern we have is for the safety and well-being of our employees. So how we do that differs from each location. So it's pretty tough to say right now how we would do it. I can tell you we are cognizant of the fact that we're going to have to do that shortly, and we would like to be able to provide services to people in a variety of ways. But until we have a better plan of how we're going to do that and when it's going to happen, I'll just kind of let you know that we are looking at it. And again, our priority is making sure that the public and our claimants remain safe.
One of the questions that we seem to get, and there's still a lot of questions around, is with Uber drivers and Lyft drivers. How should they file through this process, and what would be the best route for them to go through?
So for Uber and Lyft drivers in particular, just for these two organizations, please file through our normal unemployment insurance program. And the reason is that, I think they're typically considered gig workers or independent contractors. But for the Department of Labor and the application of the unemployment insurance law, we actually have to apply specific rules that are in statute as to whether or not an individual is a covered employee. So I think it was in about 2017, maybe. 2017, the determination was made that Uber and Lyft drivers are actually supposed to be covered employees. And as a result, they do qualify for unemployment insurance benefits through the regular unemployment process. And this was beneficial for Uber drivers and Lyft drivers before the PUA program started up, because they could get normal UI benefits. So I would let your viewers know to please apply through the normal unemployment insurance program. We will process your claim as a regular UI claimant. Now, one thing you should know is that what happens is we have to match up your wages with that of with what's provided from Uber and Lyft, and at times we do have some challenges getting that. But from what I understand, Uber and Lyft drivers do have access to that data on their platform. So just go ahead and download that data for us and be ready to share that with us, and then we'll be able to do your eligibility requirements based off of that.
I'm seeing a bunch of tax questions. Let's put this one up from Susie Shim, who says, confirm please that all benefits are taxable income, even the extra $600. Is it possible to take out the withholding taxes from the weekly benefits now?
So I shouldn't say it's taxable, it is reportable, I guess is the best way to put it. I believe with the PUA program, you agree to, what was it now? Shoot, I better check on that one just to make sure I get it correct, because I don't want to mess it up.
Sure.
But I will tell you that it is reportable.
Okay, so you potentially are on the hook to pay taxes for it.
Correct.
Well, one of the questions that it's kind of a simple one, but important is the unemployment office going to run out of money? The different sources of income, we know that there is, of course, the money that was collected in the fund, but also from the federal government. What is sort of the latest on how much money is maybe left? So
Connie, here's what I'll share with you. I'm sorry, I'm gonna just pull up some numbers for you. So from the State Unemployment Insurance Trust, since the start of COVID-19, which was March 1st, we paid out from the trust $284,951,469. Prior to that, we had about $594 million in the trust. So I will tell you that our projected date for exhausting the fund is June 11th of 2020. I had said before that it was on May 10th, but we didn't take into account that we were still receiving some tax revenue from employers. So the new date is June 11th. But we have applied, for lack of a better term, for a line of credit from the U.S. Treasury, and the money comes through the U.S. Department of Labor. So we have to each quarter apply for this. So we've been doing that diligently and on time, so that if it were to expire, we would have a line of credit to continue benefits on. I would tell you that from what I understand, that line would be tax-free, interest-free, until December 31st, 2020. So, from our perspective, we are making sure that there are funds adequately backstopping our trust to continue to pay benefits.
Wow, it's crazy to think about exhausting those funds. That's less than a month away.
Right. It's when you add up all of the money we paid through the unemployment insurance program, to date we paid just under $600 million in UI benefits. That includes the federal money as well as the state trust. Add to that another $109 million that was paid out of the PUA program, and you're talking about $709 million that we paid. I mean, it's a lot of money that's going back out. And I realize that I don't want to frustrate people who have been waiting and are still in process. But, again, those are the facts of what we're seeing now. So it is a staggering amount of money that we're seeing pay out. But again, my concern really is for the people whose claims we're still processing.
And on that, the last time you were on here, you said that you hoped that you would be basically through those, or caught up, if you will, sometime toward the end of May. Does that still seem realistic, given what you had said about the complexity of the claims that you're now addressing?
I think I don't think so. I think part of the challenge is going to be that we had thought that the number of people that were out there that were filing CCs, the initial data that said that people had clean claims that just needed to file CCs was much higher. It was about 30,000. We found out that it's only about 9,000. So the concern that we have, and again, part of the challenge with this is, the antiquated systems that we have don't provide good analytics for us. So unfortunately, we have to make decisions with the best. That's our job, right? We got to make decisions on the best data that we have. It's really difficult to ascertain really when we'll get through these, because the higher the number of cases that we have to adjudicate, clearly the longer it's going to take. And that's why what we're doing now is we're trying to get to just that subpopulation, that one population of people that we really have to adjudicate cases on. That will then help us to determine really how long we're looking at. I'll tell you that unemployment is only part of the story, right? Because it's not just about paying out the claims. There's a whole back-end audit process that we have to make sure of. We've been receiving concerns nationwide about fraud. So that's why we've been very diligent about how we've managed the trust and made sure that, as much as we wanted to just pay benefits out, we had to be mindful that there were always fraud issues. And this isn't anything about people in Hawaii, but there are people from all over the world that are trying to get access to this money. So, we've been very diligent about that. But the other portion about unemployment, I think one of your callers or posts had come in about the reemployment of HireNet. Actually, the unemployment insurance program is part of what's called the Employment Securities Act. And what it does is it doesn't just look at unemployment, it looks at reemployment. And that's an important thing to remember, that, ultimately what we want to do is get people back to work. So this whole process of the impact of COVID-19 on the department is going to be very, very far-reaching, and it's going to be going on for quite some time. And so I don't want to give people the illusion that, come end of May, everything's going to go back to normal. That's not the case. We're still going to look at a number of people who are unemployed. We still will have the extension programs going on. We still will have, we'll still have to live with the system that we have now. As much as we've been able to modernize the front end and the move people off the old web portal onto our new SQL environment, the reality is that we still have a data structure and an engine that was built in the 1980s that resides on the mainframe. So all of these things are going to be with us for quite a while into the future.
I wanted to get, to your point about the complexities and different programs that are trying to keep people employed. One of those is the PPP program. And Lisa Kavai says, if you got a PPP loan, are you still eligible for PUA? That's an interesting question because some people who applied for PPP didn't know if it or not, so they applied for benefits through the PUA system, and now they perhaps have both. So what is the eligibility there?
I'm not sure about PPP. I would have to check on that. Yeah, that's a tough one. I'm really not sure. Yeah, that's a tough question. I can look into that and try to get your response next time, if that's okay.
Okay, we'll make sure that we follow up with that. One, another question that we got in from Derek was regarding sort of the people that are calling back. And he said that he's called the hotline 4 times, and they keep the people that he's spoken to said an examiner will contact him regarding his claim. And again, he was another one in the Uber and Lyft sort of situation. What would you recommend with that? He said he's been waiting 8 weeks since he's had any income or has received since his initial claim. What is the difference? What is the examiner compared to maybe somebody else? And what is that backlog, or what does that look like?
So the claims examiner is the third level of, or the highest level of assessment that we do on a claim. They're the people who actually have to do fact findings. So they actually have to record, document what their discussion is with both the employer and the employee. It's hard to say for that particular case because it could be a situation where the person was had multiple jobs or something of that nature. But I can tell you for Uber and Lyft, part of the challenge is that we don't always get the data from Uber and Lyft on employment wage employment, the payment to individuals. So the best thing that they can do is share with us the information that they have. But that situation, once they're at the claims examination portion, it is at the highest level of complexity that we would have in a claim. And that's one of the people who are going to have to wait through the adjudication process. And we are trying to get more people who can do that. But it's not an easy thing to do. It is both slow and arduous process, but it actually requires them to render a decision that can be appealed, and then subsequently it can be challenged through a private right of action by the individual, both on the employer side and the employee side. So, it's not something that is we have a lot of people who can do it. We do have quite a number of volunteers who are working on it now, but that's the difference between a claims with a claims examiner.
I know that you had said before that some of the people who were working in a volunteer capacity at the convention center were now starting to, reattach to their previous employment some elsewhere in the state. Do you anticipate losing workers? I mean, given the high volume of calls that you're getting and all of these people who say that they're not getting the responses they need, how is that going in terms of your own staffing?
Sure. So what I can tell you is that we have been in regular discussions both with the administration, the governor's office, as well as DHERT. And the priority is to keep people staffed at the unemployment insurance office. We do have a regular schedule of people coming in. We always can use more people helping us. So, they are doing everything they can to send people our way. But as time progresses, I would imagine that people will have to go back to their desks and do some work. We are looking at ways in which we could do that remotely outside of the convention center. But yeah, right now, my big concern is the time that we have left to actually process as many claims as we can.
Okay, we know that you, again, are very busy. And again, we appreciate you just taking the time to join us. We unfortunately are out of time. And we apologize again, so many questions coming in. We will once again try to get some of these answered and consolidate as much as we can next week. But Director Scott Murakami, thank you so much for joining us once again. And we look forward to another update next week.
Thank you. Aloha.
Thank you. Aloha. We still see a lot of questions coming in for things that we addressed earlier. So as soon as this live stream ends, please go watch from the beginning some questions about taxability and whatnot. Just remember that anything that you do receive is reportable. So it depends on how much income you generate, but that does mean that it could potentially be taxed. So keep that in mind as you start to get these benefits. We know a lot of you are frustrated. We appreciate all your questions. Please, if we didn't get to something that you want covered, please write and let us know. Like that PPP question, we'll be asking that next week. I mean, the wonderful thing is that Director Murakami has made himself available, and we can continue this conversation week to week and hopefully get as many of your questions answered as possible.
That's right. And again, I think that there are still some questions around the pool program as well. A lot of people still asking about those. So we will make sure that we follow up and do our best once again to consolidate all of that. In other news, of course, we'd like to always end with some happier news and highlight some of the heroes and the people doing good things in our community. And this one, we're focusing today on Hawaii Island.
That's right. Activate Hawaii Aid is a coordinated emergency response to the needs right here on Hawaii Island. They are doing a Feed the People. Oh, we got to squeeze to this side. Feed the People drive. So I've gone onto their website. It's really amazing. You go to activatehawaiiaid.org and you can fill out a form if you need help, if you need food. They're doing these food packets, or if you want to donate in some capacity, maybe you want to help drop off. There are so many elderly folks on this island that don't necessarily have access to transportation, or because of COVID, it's dangerous for them to go out. So they're really trying to link resources with people who can help provide them. Another thing that they're doing is keiki care packs. These include snacks, and they also non-perishable food, coloring sheets, and resources to help kids better understand the pandemic, as well as materials to support parents to help engage their kids and cope with the stress of living through this pandemic. We're seeing so many families, being inside without having school to keep their children occupied. So these keiki packs are wonderful ways to engage kids and give parents some ideas on how to spend that time with kids at home. So we mahalo activatehawaiiaid.org. They've partnered with the Chef's Hui along with a number of organizations, including the Hawaii Community Foundation. They're doing great work here on the Big Island. So again, check out their website, activatehawaiiaid.org. The other thing, Ryan, that we want to also remind people about is that there's a food distribution happening tomorrow in Honolulu.
That's right. We've seen the large number of people that go there, the lines that have been meeting those distributors each and every week. Again, that will be happening tomorrow at Aloha Stadium beginning at 10 a.m. You can get more information at the Food Bank's website that we have listed there below. And again, this is sort of something that has become a weekly routine there. Wednesday and Fridays, they seem to be doing it at Aloha Stadium. We also saw it, though, at Lyft Community College. So they're sort of maybe moving around. But right now, again, tomorrow's one will be at Aloha Stadium. You won't be able to get food from 10 o'clock, but we do have heard stories of people lining up as early as 7 a.m. So expect to sort of wait if you're going to be in those long lines. But again, we mahalo the Hawaii Food Bank as well as their partners for doing this, again, this bi-weekly food distribution.
Yeah, and that food distribution, they really recommend making sure that you have a full tank of gas and that you maybe come 2 to 3 people in a car, heads of households. You do have to prove that you are from different households, and have your trunk clean and empty so they can just put the food right in there. It's 50 pounds of fruits, vegetables, eggs, milk, and meat. So a really nice size package for people, but you do have to wait in line. So pack your patience, and we really appreciate all the volunteers who are out there helping to make this possible, because we know that so many families are relying on this food aid right now.
That's right. And tomorrow we will be back once again with our Ask the Doctor series. We're actually going to be focusing on kids and pediatric doctors and the impact that this has had on children, but not only just, of course, the impact of COVID, but just overall the mental health of children during this time. So we'll be talking to Dr. King from Hawaii Pacific Health, who will be joining us. And then on Thursday, we'll be speaking to Dr. Sarah Park.
Yeah, we really look forward to talking to both of those doctors. Dr. King is going to help us with how to make sure that our kids are staying healthy through the pandemic. And Dr. Park will tell us how to keep our community healthy. She's, of course, the state epidemiologist. We're going to be talking to her a lot about testing and contact tracing as we move into this next phase of reopening our community. How do we do that safely? And how does the state continue to make sure that we're tracking COVID in our community?
That's right. So again, a busy week, and we appreciate everybody for tuning in. Once again, we'd like to thank our partners, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, for bringing you this conversation. Again, we apologize that we didn't get to every single question. We always know that Director Murakami has a lot of questions, and we try our best to cover as much ground as possible. We encourage you to go back and watch past episodes, as many of the questions that were asked later in the show were actually answered in weeks prior. So we hope that you might find your answer there. And good luck. We know that it's a long wait for many people and that you continue to keep calling and emailing, but hopefully you get some answers soon, and we'll continue to provide you as much support as we can as well. Until tomorrow at 10:30, we'll say aloha and see you then. Aloha.